हेलो फ्रेंड्स, वेलकम टू माय चैनल एएमएस एजुकेशन। आज का हमारा टॉपिक है डिप्रेशन। सो विल सी व्हाट इज डिप्रेशन। मेजर डिप्रेशन इज क्लासिफाइड अंडर mood disorders which are characterized by disturbances in the regulation of mood, behavior and affect that go beyond the normal fluctuations that most people experience. So ये classified होता है under mood disorder. इसका characteristics है disturbances in regulation of mood, behavior and affect that go beyond the normal fluctuation that most people experience. Also, it is also called as unipolar major depression. Major depression is a syndrome of persistently sad mood lasting 2 weeks or longer. So depression, major depression में का मीनिंग होता है जो persistently sad mood है और lasting 2 weeks और उसी या फिर उससे ज़्यादा. It is accompanied by other problems like feeling of guilt, helplessness or hopelessness, poor concentration, sleep disturbance, lethargy, appetite loss or weight gain, anhedonia, loss of mood reactivity, and thoughts of death. Suicide is the most serious complication of major depression. It occurs in nearly 15% of patients with untreated depression. So this was about what is depression. Now we'll see what is the pathophysiology. The underlying pathophysiology of major depressive disorder has not been clearly defined. Current evidence points to a complex interaction between neurotransmitter availability and receptor regulation and sensitivity underlying the affective symptoms. Preclinical trials suggest disturbance in CNS serotonin activity as an important factor. Other neurotransmitters implicated include norepinephrine, dopamine, glutamate, and brain-derived neurotrophic factors. The role of CNS 5-HT activity in the pathophysiology of major depressive disorder is suggested by the therapeutic efficacy of selective serotonin reuptake inhibitors. An integrative model of late-onset depression posits the age-related brain changes and disease-related changes coupled with physiological vulnerabilities and psychosocial adversity leading to disruption in the functional circuit of emotional regulation. So exactly हमको cause नहीं पता, but अलग-अलग theories है जो nervous system CNS का जो serotonin activity हो सकता है या norepinephrine, dopamine, glutamate इन neurotransmitters की वजह से हो सकता है. So अलग-अलग theories अलग-अलग suggest करते हैं. So this was the pathophysiology of major depression. Next are the causes. So exact cause is not known. So predictions are risk factors होते हैं genetic, biochemical, physical, psychological, social factors. So genetic में होता है 2 to 3 times more common in people with first degree relative with the disorder. Biological, primary defect sites at prefrontal cortex and basal ganglia. It may involve serotonin, endocrine, hypothalamic, pituitary, adrenal regulation system. May also be associated with abnormal cortisol levels. Psychosocial में आएगा unclear relationship between psychological stress, stressful life events and depression onset. Pharmacological में certain drugs होते हैं medical and psychiatric condition can cause depression. Some of these medications include antihypertensives, psychotropic, anti-Parkinsonians drugs, oral anti-diabetics, steroids, and chemotherapeutic agents. So these are the causes: genetic, biological, psychosocial, and pharmacological factors. Clinical manifestations देखेंगे हम. According to DSM-4 criteria, depressed mood रहेगा. The effect of depressed person is one of the sadness, dejection, helplessness, hopelessness, and hedonism. There is decreased attention to and enjoyment of previously pleasured एक्टिविटीज. जिसमें पहले हमको मजा आता था, अच्छा लगता था, वो उसमें एंजॉय नहीं कर पाता है. वेट चेंजेस होता है 5% or more in a month. Unintentional weight change. Change in sleep pattern. Sleep disturbances are common, either insomnia or hypersomnia. Agitation or psychomotor retardation. A general slowdown of motor activity commonly accompanies depression. Tiredness रहेगा. Physically there is evidence of weakness and fatigue. Very light energy to carry on with the activities of daily living. ADL. Worthless or guilt, difficulty thinking, focusing and making decision, hopelessness, helplessness or suicidal ideation. So this was about clinical manifestation. Next हम देखेंगे assessment and diagnostic findings. A number of tests should be conducted to diagnose depression. Beck Depression Inventory is a psychological test to determine the symptom onset, severity, duration, progression. Dexamethasone suppression test showing failure to suppress cortisol secretion in depressed patient. Toxicologic screening suggests drug-induced depression. Diagnosis is confirmed if DSM-5 criteria are met. Medical management. So, management include करता है psychotherapy, ECT, simulation techniques. Psychotherapy. There are a number of evidence-based psychotherapeutic treatments for adults, which major depressive disorders such as behavioral therapy, cognitive behavioral analysis system of psychotherapy, interpersonal psychotherapy, problem-solving therapy, and self-management or self-control therapy. ECT is highly effective treatment for depression. Simulation, transcranial magnetic stimulation, TMS, is approved by the FDA for use in adult patients who have failed to respond to at least 4 adequate medication or ECT treatment regimens. So this is medical management. Pharmacological में हम देते हैं antidepressants, atypical antidepressant, other classes, combination therapy. Antidepressants में SSRI, selective serotonin reuptake inhibitor, commonly prescribed as first-line treatment. It decreases the serotonin levels in the brain, helping to elevate the depressive symptoms. Example: fluoxetine, sertraline, escitalopram. We have SNRIs, serotonin norepinephrine reuptake inhibitor. This medication targets both serotonin and norepinephrine. Examples: venlafaxine and duloxetine. Tricyclic antidepressant, although less commonly used due to side effects, TCAs can be effective. They influence serotonin and norepinephrine levels. Examples: amitriptyline and nortriptyline. MAOI, monoamine oxidase inhibitors, are used when other medications are ineffective. They affect multiple neurotransmitter, dietary restrictions, and potential interaction with other medications need to be considered. Atypical depressants, bupropion. This medication affects norepinephrine and dopamine levels and is sometimes used when sexual side effects are concerned with other antidepressants. Other classes: N-methyl-D-aspartate receptor antagonist ketamine, a rapidly acting antidepressant, works through the NMDA receptor. It's used in treatment-resistant depression under controlled setting. Combination therapy, a combination of different classes of antidepressants or antidepressant combined with mood stabilizers may be used in severe or treatment-resistant cases. So this was the pharmacological management. Now we'll see nursing management, nursing assessment. It includes verbalization of inability to cope or ask for help, sleep disturbance, fatigue, abuse of chemical agents, and reports of muscular and emotional tensions and lack of appetite. Objective cues include lack of goal-directed behavior or resolution of problem, inadequate problem solving, decreased use of social support, inability to meet role expectation, basic needs, and destructive behavior toward self. Nursing diagnosis: ineffective coping related to situational or maturational crisis, hopelessness related to long-term stress, fatigue related to stress and anxiety. Planning and goals to determine degree of impairment, to assess coping abilities and skills, to assist client to deal with current situation, to provide for meeting psychological needs, to promote wellness. Nursing intervention: provide for patient's physical needs, assist with self-care and personal hygiene, encourage the patient to eat, give warm milk or back rubs at bedtime to improve sleep. Plan activities for time when the patient's energy level peaks. Assume active role in initiating communication. This can be done by sharing observation of patient behavior, speaking slowly, allowing ample time for him to respond. Encourage करना है to talk and write down feelings and by providing structured routine बना के देना है. Avoid करना है cheerfulness, but does not hesitate to laugh with him and point out value of humor. Educate करना patient about depression. Explain that depression can be eased by expressing feelings and engaging in pleasurable activities. Emphasize करना है कि और भी effective methods है ताकि उनके symptoms को relieve कर सके. Help करना patient को recognize कर सके distorted perceptions and link them to his depression. Ask the patient whether he thinks about death or suicide. Signal an immediate need for consultation and assessment. Risk of suicide is higher with lifting of depressed mood. So this was about nursing intervention. Valuation, patient's ability to assess current situation accurately, patient's ability to identify ineffective coping behavior and consequences, verbalization of awareness of own coping abilities and feelings congruent with behavior, meet physiological needs as evidenced by appropriate expression of feeling, identification of option and use of resources. So this was about depression.